Hello friends, in this video we are going to discuss one of the important topic of the pathology, that is atherosclerosis. The handwritten notes of this entire lecture are available on my Telegram channel. The link is in the description. So do visit my Telegram channel. Now coming to the topic, atherosclerosis. The first thing that you need to understand is that it is a chronic condition. It is chronic condition. It develops over a period of time and is characterized by the building of plug inside the arteries. There is a plug formation inside the arteries. This is how it is characterized. Now, coming to the risk factors, the reasons that lead to the atherosclerosis, etiology, that is, high cholesterol, high blood pressure, smoking, diabetic patient, and obesity are the most common reasons that cause atherosclerosis, that is, formation of plug inside the artery. Now, coming to the pathogenesis, how this condition develops in the body. All the etiological factors that we discussed above lead to endothelial injury. Now, you are aware the endothelial is a inner lining of the vessels of the body. So, there is endothelial injury. Once there is endothelial injury, there will be what? Endothelial dysfunctioning. The endothelial dysfunctioning will trigger the immune response. It's very obvious. There will be the immune response will be activated. There will be infiltration by the immune cells. But besides the infiltration by the immune cells, there also will be infiltration by the lipid. The lipid will also be present. It is seen in the patients of cholesterol who are suffering from the high cholesterol. So it is obvious that there will be a lipid in their vessels. Inflammatory cells. Now these immune cells, or you can say inflammatory cells, what do they do? They act on the LDL and convert into oxidized LDL. You are aware of the term LDL. It means low density lipoprotein. It is also known as bad cholesterol. It is responsible for carrying the lipids from the liver into the vessels. So the lipid present there is LDL. What immune cells do, they convert the LDL into oxidized LDL. Once the LDL is converted into oxidized LDL, what happens is macrophages come to play. You are aware that macrophages function is to phagocytosis. So what they do, they ingest this oxidized LDL. Now, here for initially it was LDL. It converts into oxidized LDL. Now the oxidized LDL is eaten up by the macrophages. Now you can say the macrophages that eat this LDL are filled with this LDL. They are filled with this lipid, right? They are lipid laden macrophages. But there is another proper term used to describe the macrophage which is filled with the lipids. It's called a foam cell. So foam cell is nothing but a lipid laden macrophage. Once there is formation of foam cells, over the period of time, these foam cells combine with smooth muscle cells and connective tissue cells and lead to the formation of the plug. Let me make this more clear to you. Imagine this is an artery, and here was the formation of the foam cells. This was foam cell. Alright, these were foam cells. Once these foam cells are formed, now over the period of time, it combines with smooth muscle cells, connective tissue cells. What? Smooth muscle cells and connective tissue. And now there is a formation of what we call plug. So what is plug? I can say here plug is foam cells plus smooth muscle cells plus connective tissue. Alright. So right, there is a formation of atherosclerotic plug over the period of time because it's a chronic condition. Once the plug is formed, the problem is this plug is prone to rupture. It is prone to rupture and it lead to thrombosis. It is very obvious. Here is this plug formed. Imagine this was the artery and here was this plug which was formed. It is very prone to rupture. Imagine this plug ruptured. Now there will be what? There will be thrombosis, or I can say clot formation. It will become like, now there will be a clot. There will be a clot at a site. Now this clot have the potential, they can partially or fully block the vessel, right? After this clot is formed, it has the potential to partially or fully block the vessel. Once it do so, it block the artery. Partially or fully, it can lead to stroke or MI, that is myocardial infarction. This is what I said. This plug is prone to rupture and it can lead to thrombosis, that is clot formation, and this clot can partially or fully block the artery and lead to stroke or MI. So this is in complications of the atherosclerosis. Atherosclerosis can lead to stroke or the MI. This is all for this video. Thank you for watching.